This is Dr. Mirrafati from Mirrafati. Today we're doing an interesting case from a long journey about a year ago. So she came to me about a year ago and she had a big abdominal pannus after having massive weight loss. And she would explain to her the whole journey, and then she said that multiple doctors she's been to refused to do her, and she will explain more, but we did it. And I did explain that since you're so big and I didn't want to do the vertical scar, you're gonna have some hanging over here, which you have to come back after a year, and then we basically revise the dog ear, and that's what we're doing today. And doing a little bit of liposuctioning. I'm also doing capsulectomy or capsulotomy on our implant here. It got a little hard, so I'll let you take it from there.
Well, about a year ago, I came to you guys after seeing about 6 surgeons, and all said no to trying to help me in this journey. They said, no, your BMI is too high. We're not gonna be able to touch you. Get your BMI to 30, and I'm like, how much more weight do I gotta lose, you know? And so I was happy that you said yes, and it's been great. You know, I had, it's been yeah, a nice little journey since then. I'm telling you, saving money on clothes with less yards, all of that's great.
Well, that's one of the problems that I hear a lot, and one of the things is that you know, you always tell a patient bring your BMI to a certain level. Well, if they're doing their best and they're sort of staying at this place and they have lost 100 pounds, and now they got, and I will post a preoperative picture so you can see what I'm talking about, and I will post a picture today so you can see the difference. And obviously 6 weeks from now we do another post of what we have now. You know, if you just keep refusing the patient, nothing good will come off of it. She went through this drastic weight loss, and if she walks around with this pannus hanging down, and if the doctors as a cosmetic plastic guys, we keep refusing them, what's going to happen? They're going to go back into the cycle of, okay, I lost the weight, I might not be diabetic no more, but I can't show this off, I don't like this, and they might reverse them back to the idea of, let's go back to eat again because that was more comforting. That's the idea, that's the thing that I didn't want her to happen. That's why I said, look, we're gonna do it, but I'm gonna tell you, you're gonna have these dog ears, right? Yeah. We mentioned all that, and she was very pleasant. You live about an hour away or an hour and a half, so, and she had to come to us often because we had to make sure everything is okay. But hey, you know, it takes two to dance, so it's like a tango. She moved, we moved, so both together, that's where you achieve the greatness, I guess. That, you know, teamwork makes dream work, I guess, right?
Yeah,
so that's what we're doing. So we're looking forward to taking it in. I might go and show some picture of the capsulectomy or capsulotomy when I'm in the operating room, and obviously we're gonna interview her maybe in 6 weeks and then go from there.